My name is Paul Lee. I'm an anesthesiologist. I also have fellowship training in interventional pain management. I became interested in interventional pain management while rotating through the clinic in residency. I found it interesting, challenging, and quite rewarding. If I had to pick a moment in my life or in my childhood that maybe influenced my decision to have a profession in medicine, it would probably be one of two things. Unfortunately, when I was around 12, I developed what's called a thyroid ductal cyst, which required hospitalization for about a week. So during that time, I really interacted a lot with nurses and physicians, and I found it interesting. I thought their compassionate care was drawing to me. Later on, a few years later, I broke my arm, which unfortunately also required additional hospitalization, which I think at that time really interested in me in just providing care and helping people heal. And I think those did affect my decision to go into medicine. I feel the best way to build a strong and trusting relationship with my patients is to have an open communication. I find that typically I let the patients talk. I don't interrupt them. I let them tell me their story, the history of how their pain began, what therapies they've tried, and how they came to be in our clinic. A lot of patients that we've seen have been to other clinics. They have felt not heard. They've tried a lot of modalities of treatment without success. So I let them talk. I don't interrupt them. I want to know their history in their own words. We thoroughly review the medical history before we see the patient so they know that we've taken the time, that we care about their care. I feel that when the patient feels that I know them as a patient and I care about them, that builds a good rapport. I try to stay updated in the latest in pain management techniques and therapies by just having an interest, attending the national conferences. But most of all, I think the biggest difference is talking to colleagues. Our practice has several physicians. We all train in different areas. We have different interests. And we have an open communication style. We bounce things off of each other. And we just learn from each other. I think that's the biggest difference. About a year ago, a patient came to me with severe pelvic pain, and we were able to provide a therapy called a DRG stimulator, which has given her life back. She's back at work. She's able to function. She's off of medications. So I think that was a great success. Outside of work, I rewind and recharge by two things. One is going to yoga. I have a daily yoga practice. I feel it's a mind-body approach that helps me calm down, but also keeps me physically active. The other thing I like to do is I have a lot of plants. I feel like it's very calming to water my plants and see them grow. Pain is inevitable, suffering is optional. Advanced pain care, the pain stops here.